Ladies and gentlemen, thank you for your patience in holding. Welcome to the AHA webinar, Ethical Coding and Being Compliant. We now have your presenter in conference. Please be aware each of your lines is in a listen-only mode. You may submit questions electronically at any time by using the Ask a Question box located on the bottom left of your webinar screen. Please make sure your questions asked are based on the content of the webinar. At this time, I'd like to introduce our speaker, Mrs. Gloryanne Bryant, an AHIMA ICD-10 CMPCS approved trainer with over 35 years of HIM experience. Ms. Bryant, you may begin, please.
Thank you, and welcome to everyone to our program today on ethical coding. This is a topic that's near and dear to me, and I'm passionate about it. So you probably see that or hear that in my voice today, but I'm very glad to be here. I do have a brief disclaimer, and we won't read through it. You have the opportunity in the material to look at this. But again, welcome everyone to this program. Thank you so much for being here. Let's next go to our goals and objectives for today. We will look at providing information regarding risk areas, the False Claims Act, compliance, review the AHIMA Standards of Ethical Coding Principles, a focus for today, and understand and learn the key practices of coding compliance, and enhance your knowledge and understanding of ethical standards and the linkage to compliance in the work that we do. So let's start off with a look at the False Claims Act, or what we refer to sometimes in healthcare as the FCA. And this particular act, which I've referenced at the bottom from the regulatory perspective, so you have it as a reference, is when a false claim that can take form and be very common for goods and services not provided or provided in violation with contract terms and specifications, statutes, and regulations. Now, there are a lot of pressures out there in healthcare, financial reimbursement pressures, which can result in false claims or even false claim activities. And did you know that the OIG reported so far in 2017, they expect to have investigative recoveries of $4.13 billion with a B dollars. That's huge. And the OIG has reported 881 criminal actions so far and 826 civil actions with 3,200 exclusions from the federal healthcare program. So it is a very active area. The False Claims Act really is important for you to know about as a coding HIM professional or HIM professional. And we want to note that the liability that we have, it's between $5,000 and not more than $11,000 with triple damages per violation. And this was changed in 2015 to the higher numbers at $10,000 to $21,000. Now, an example that might come to mind is someone knowingly, could be a physician or other, knowingly submitting a claim to the Medicare program for a higher level of medical services than were actually provided. Then the medical records documentation support. Very common for us to be familiar with this. There are penalties, civil, for violating the False Claims Act, and they include fines, as I mentioned, 3 times, and can result in up to that $21,000 per claim filed. Now, the Health and Human Services budget for 2018 that has been proposed has $2.1 billion for healthcare fraud, waste, and abuse investigations. $2.1 billion allocated so far proposed for false claims. And that's a lot of scrutiny, I would say, in 2018 that we can probably look forward to in a way. Now remember the recoveries that they had also in billions of dollars. So they do see that the efforts that they put forth in the area of false claims does produce results. So where are we at risk? Well, I read an article and I was very impressed back in April. BrownForwolf.com they outline the 20 top healthcare risk areas. And so you see on this slide here some of those risk areas. Now, where do we fit as HIM, coding, or even CDI professionals? If you look in the column on the right-hand side, the third one down, clinical documentation improvement, CDI is listed. Inpatient coding, a little farther down, charge capture, which is also related to CPT codes, and then physician coding and billing. But billing in general would be an area that, well, what is it on the bill or the claim that's incorrect or creating this false claims? And that typically would be something related to a code, either a ICD code or it could be the CPT code. Now, gaming the system and manipulating can bring about these risk areas. And the risk areas, ones that you see listed here from that report, drill down a little bit further, and under each of those you'll see some focused areas. We have ambulance and transportation services, clinics, and under clinics you see that they've identified that there is fraud, money laundering, false claims, kickbacks, so on, in some 4 areas that are targeted. There's device companies, diagnostic services. Depending on where you in the audience work, these may be a particular area that will be of interest to you to know about. Let's look at the rest of some more of these targets. Dietary supplements, drug companies, been on that high risk area for a number of years. Durable medical equipment, also been on the risk and list for a number of years as well. Now, these are also on that list for electronic health records, health maintenance organizations, home health providers. Goodness, home health providers have many areas where we've got risks and targets. If you work in that area or have that area as part of your organization, you certainly would want to read through this long list, and we're not going to do that today. But these are here to help you understand how many risks there are. So let's drill down to the last step, and that is the area of hospice care. And then you'll notice on the right-hand side, hospitals and health systems. There are a number of target areas that we can learn from of prior investigations, and that includes the kyphoplasty. In 32 hospitals were identified with false claims, cardiac device implantations, long-term care and rehab for medically unnecessary services. So those are some of the things that are definite risk areas and targets. Now, as you think about a false claim, one of the things you have to keep in mind is that we undergo a lot of auditing in our world, and for a good purpose, because audits are actually a good thing to do. But they do, I see, sometimes in the results, an overpayment was obtained, so we need to correct that. One of the things you need to know about as part of your due diligence as an ethical professional is making sure we refund or rebill, repay for those overpayments. This is a particular area that you need to make sure in your coding audit, any type of review, or even when you identify it throughout your work process. If you do internal audits, external audits, this may identify an overpayment. And we have specific, under the ACA law, rules around rebilling within 60 days of that confirmation identification. So I put this language in here to help you because I find sometimes in a workshop, seminar situation, or via the internet, and we exchange emails and we're talking, that the rebilling isn't discussed or even mentioned when they see things that are wrong. Now, they may correct it within the medical record or the coding abstract, but that rebilling step needs to occur. So we want to remember that this is important. For overpayments, any overpayment improperly retained by a person after the deadline for reporting and returning an overpayment can result in the False Claims Act and civil monetary penalty liability. So that's very important that we adhere to this requirement. Think about that for a minute when you've got a known or you've identified, yep, this is incorrect, or an audit comes forth, and yes, we agree that this did result in an overpayment. We need to then start that clock ticking and get that process rebilled and the money given back within that time frame of 60 days. And in some organizations, the refund obligation may be felt for the federal programs is not an area that affects them. Well, actually, under that law, we are obligated, and it applies broadly to providers, suppliers, Medicaid, managed care, Medicare risk, prescription drug plan sponsors. So it's broad. So it's all across. We are providers if we're a hospital. We are providers if we're a physician, etc. So it's important to identify that. And again, the person in the law is defined, as well as what the overpayment is in definition in the law. So think about your ethical responsibility in the process of what you do day to day. Are you and have you rebilled or repaid for those overpayments that were identified, if any? You're all familiar with the Office of the Inspector General. This is one of those important messages that I like to share. The Office of the Inspector General has said it is incumbent upon our health system corporate officers and managers to provide ethical leadership to the organization and to assure that adequate systems are in place to facilitate ethical and legal conduct. Note that it says ethical and legal. And keep in mind that sometimes something labeled unethical may not necessarily be illegal, but in this context, they've identified both of those. Something being unethical, something being illegal, that conduct needs to make sure that we have leadership in place. And it's very important to take this message and think about what your ethical responsibility and legal conduct is around coding, because we know that it is so tied to reimbursement. Another thing that is very valuable and important for you to do as an HIM coding professional is look at the reports that the Office of the Inspector General puts out. Now, here I have 3 cover slides from these reports. I've shrunk them down and cut them up for you so you can just see the cover, so you get an idea of what they were focusing on in these different investigations and what they identified as overpayment areas. Why this is so important is you say, oh, this isn't me, it was someone else. These typically give us a clue at what the government is looking at. And when I talked about risk areas, this is another area where we as HIM coding professionals, even in the CDI area, need to be looking at. What is the OIG publishing or investigating? And these 3 reports might be something you would like to download. So a tip here is you can download these same reports as I have done. What you do is take that title, like you see on the one on the far left, Medicare inappropriately paid hospital inpatient claims subject to the post-acute care transfer policy. Type that into your search engine, and you should be able to come up with that OIG report. Same with the one in the middle and on the right. So these are very important. The one in the middle is looking at a healthcare system, and they were looking at 2013 and 2014. And the one on the far right was a medical center, and this was regarding severe malnutrition. These OIG reports can come out any week, and you can get on their listserv and be a part of the distribution blog, which is what I've done. So I get the information from the OIG anytime they have a new report published. Also, to give you some hindsight, just last week, the OIG published another report on overcoding of malnutrition. And this is certainly an area where we have ongoing issues around documentation and the coding classification system. It is itself under kwashiorkor. So that's another report that just came out last week. Another important area is that the OIG, under the joint direction of the Attorney General and HHS, and they coordinate their activities, federal, state, and local. During fiscal year 2016, they won and negotiated $2.5 billion in healthcare fraud judgments and settlements, and attained additional administrative impositions. In 2016, over $3.3 billion was returned to the federal government or paid to private persons. So a lot of emphasis around these activities, law enforcement activities in regard to fraud and abuse. Now, I did touch a little bit on this one report, and I want to bring it up a little closer here. This particular report, Coding Compliance, is very much a center of this, around the severe malnutrition kwashiorkor. And it does date back when we were in ICD-9, so the codes that they're focusing on are a little different than we see today, obviously. Their focus is on the Medicare program and the Medicare program for overpayment in this particular report. I want to, again, alert you that there was that new report that came out last week, about a week ago in November. Then that report on kwashiorkor, they had looked at 2,145 medical records at 25 different providers, and they only found one that was accurate out of 2,145. So kwashiorkor certainly is an issue. That report you can Google, and it's not in the material, so I'll just say it to you. The title is called CMS Did Not Adequately Address Discrepancies in the Coding Classification for kwashiorkor. OIG, this is an OIG report, so you can look for that as well as an important one. Why I want you to look at them is because you want to see what they're finding in these reports and studies and investigations, and how much money potentially we are at financial risk for. So this is a good one to look at. And on this sample in particular, in this particular institution, they did find overpayment of $1.4 million from that auditing period. Another important area to look at is, there we go, I'll advance another one here. There we go. Is the Medicare fee-for-service report. I don't know how many of you find this or see this, but this is an important document as well. I look through all the targets. I know it's kind of small, but go ahead and, after the program today, do a little homework. Medicare fee-for-service 2016 improper payments report. And this has all different categories, all different settings, what they found as being improper payments. They show many different categories of improper payment and what they think are the primary issues. Lack of documentation, didn't meet medical necessity, so on. Really important report to look at. And they include coding in that as well. The Healthcare Fraud Prevention and Enforcement Action Team, or HEAT. This is led by the Deputy Attorney General and the HHS Deputy Secretary and top law enforcement agents from a variety of areas, including the DOJ. And they operate and look at and marshal significant resources across the government to prevent waste, fraud, and abuse. They reduce healthcare costs by doing that to improve quality of care. They identify best practices, and they build upon existing partnerships that are out there. So you may have heard of the HEAT. It's still out there and it's still operating. And all of that, those risk areas, what are targets, and they're more than what we've had time to cover today, brings us to the topic of being ethical. And I look up this definition, which sometimes is interesting to just look up a definition and get the understanding of that. A key component can be personal ethics, workplace ethics, which we talk about here, professional ethics, behavior and being honest, doing the right thing at all times. And we're hearing a lot about that in our world today. And in healthcare, we certainly have that. We work with a lot of different challenged patients and processes and complexities. And we have to possess a high degree of integrity. Ethical behavior, by definition, can include good for your business, demonstrates moral principles, honesty, fairness, equality, dignity, diversity, and individual rights. So in our profession, we do have documents, and this one that I'll focus on today is the American Health Information Management Association standards for ethical coding. So this is setting a standard document. This is where we need to be as our standard for consistency and continuity. So in the focus of this portion we're going into now, we're going to be focusing on this document. Some of you may have heard about it. It was released last December, a year ago. It was a newly revised, and it contains some revisions to the prior version, which was 8 years prior to that. We've included, and why I say we, I helped work on the work group that put together the standards, and I'm really excited about some of the information we have in here. I'm revising a lot of the language, simplifying it somewhat, making it more consistent. And we've included, of course, an introduction. We have some new sections like a definition section, which we didn't have before. There are 11 principles within there. So think about that when you think about ethics in coding, 11 principles that you need to follow. And we've given examples on how to interpret and follow these standards with guidelines. There are some footnotes and resources as well. One of the key things I want to mention to you is that in the language for this, although from the American Health Information Management Association, it's for any coding professional, whether they have a credential with AHIMA or some other organization. The standard is setting that industry standard for any coding professional that we should be following and adhering to this standard. Now, bolded wording I've put in here because I've included that as part of the presentation. And that's there to just guide you and bring some attention. I know that some of you may, in the audience today, might think that these standards don't apply to you, but the standards are for the totality of the coding industry. Remember that. They're for everyone in our industry of coding. The standards are intended to assist and guide coding professionals. Remember, I mentioned any coding professional, whether credentialed or not. There still are coding professionals that are not credentialed, but the majority are, including but not limited to coding staff, coding auditors, educators, CDI, managers responsible for decision-making, operations, and even students of coding. These ethical standards apply to all. Remember, totality of the coding professional and industry. And they are relevant for all healthcare settings. It doesn't matter where you work. And I've heard that before. Oh, I don't work in that particular area. It doesn't apply to me. That's for hospitals. Not true. These apply to all healthcare settings, regardless of where you work, inpatient, outpatient, post-acute, alternative care, etc. So keep that in mind as we go through some of these key principles today. They are here, again, to help guide you, create consistency, continuity in our industry while promoting ethical and integrity across. As I mentioned, there are some definitions in the standards. So in the definitions, they've taken some key words that are used repeatedly in the standards and define those so there is no misinterpretation of what they mean. By indicating who a coding professional is, this is in this document, in this standard, what it means, what coding-related activities, and there are lots of coding-related activities, but by definition for the standards, they're anyone who selects, researches, completes code assignment, queries, does health record data abstraction, data analytics, someone who reports with code, does coding audits, does remote coding, coding educational activities and functions, all those coding-related activities. Throughout the standards, we've used the word data. By data, we need all healthcare data elements, including clinical data, demographic data, and financial data. You'll see these words, again, used multiple times in the standards, and they're there to now, with definitions, for consistency and continuity for the reader and the user of these standards. I think already you're thinking, This is good information, good that we have this in our industry. We need this type of standards in our industry as we promote greater compliance and ethics. So what is documentation when we think about an ethical coding standard? It's that clinical documentation found in the health record or medical record, whichever term you wish to use, in any format. It could be electronic, or it could be a traditional paper record, any format. What is an encounter? And if you recall, in our official coding guidelines, we use that word encounter. Sometimes we think back a few years ago, and we used to say the discharge or the admission or the office visit. Those are all considered encounters by this definition. What are established practices in coding? Well, it refers to what's generally recognized in the practice briefs and accrediting body standards across the industry, such as those that AHIMA publishes. And for a healthcare professional, it's anyone who's educated and skilled in any aspect of healthcare, including direct and indirect patient care. The provider, and we have a similar definition directly from the guidelines, coding guidelines. What is a query? It's a clarification, a question to a provider through written, verbal, or electronic means regarding or related to the clinical documentation in that health record. And then coding requirements. This was a big one. We kept going through and saying, well, what is a coding requirement? Well, it's our conventions, it's our official coding and reporting guidelines, and it's the CPT rules by AMA. So we need to remember that these are the standards that we follow. It also includes AHA coding clinic for ICD-10 and for HCPCS and CPT assistant. So we have those as coding requirements of your job, of the coding professional for the standard. And again, we have 11 standards, both in the 2008 version and in this 2016 version. We've included shall and shall not language in both versions, and they include examples. Not all the time, and every standard has an example, but a lot throughout the program, throughout the document. It's all healthcare settings, all coding professionals, and there's a new principle terminology classified under technology. So yes, they had 11 principles in the version from 2008 and this current version, but under principle number 9, it tends to be new, and we've combined 2 others into one. So still have the same bottom line number, but technology was addressed in principle number 9. And that's a big one right now, of course, with electronic health records and computers to assist us in coding. The 11 standards, and the first 5 are listed here. These are the standard principles. With each of these, we have a breakdown of examples and shalls and shall nots. We don't have time today to go through every single one, but we're going to go through quite a bit of this. So as I read through this, I want you to think about, how do these principles apply to me, my department, my company? Are we being compliant and ethical? Think about that. So you as a coding professional, you apply accurate, complete, consistent coding practices that yield quality data. Number 2, you gather, report all data required for internal and external reporting in accordance with applicable requirements and data set definitions. The ethical coding includes assigning and reporting in any format only the codes and the data that are clearly and consistently reported by health record documentation in accordance with applicable code sets, abstraction conventions, and requirements. Ethical coding is querying and or consulting as needed with the provider for clarification and additional documentation prior to final code assignment in accordance with acceptable healthcare industry practices. Also, ethical coding is refusing to participate in, support, or change reported data and or narrative titles, billing data, clinical documentation, practices, or any coding-related activities intended to skew or misrepresent data and their meaning that do not comply with requirements. So as I said, think about those. We must follow these to be part of ethical coding. Number 6 tells us that ethical coding facilitate, advocate, collaborate with healthcare professionals in pursuit of accurate, complete, reliable coded data in a situation that supports these ethical coding practices. We advance our coding knowledge and practice through continuing education, including but not limiting to meeting continuing education requirements. And that's important because sometimes, yes, we require 12 hours of continuing education, for example, but maybe we need more than that. So it's not limited to the requirements. Maybe we need more than the requirements because something in the regulations has changed, or a guideline, or a practice, or a code. So it's very important to think about that. We, as ethical coding professionals, maintain the confidentiality of protected health information in accordance with Code of Ethics and, of course, HIPAA under that. We refuse to participate in the development of coding and coding-related technology that is not designed in accordance with requirements. And we have those definitions, so there's that technology-related principle. Demonstrate behavior that reflects integrity, shows a commitment to ethical and legal coding practices, and fosters trust in professional activities. And the 11th one, the principle, and you may get questions about this particular one because it's quite lengthy and covers quite a broad area. It's the final coup de grace. As an ethical coding professional, refuse to participate in or conceal unethical coding, data abstraction, query practices, or any inappropriate activities relating to coding, and address any perceived unethical coding-related practices. So think about that one in particular. Now I'm going to expand a little bit on a couple of these and give situations and examples of the ethical coding that you may think about. So let's look at number 1. And as I mentioned, what the principle does is it gives you a shall and sometimes even a shall not. And as you can see from this, we're covering our shall. We have a shall not also for principle number 1. And there are examples of that given under 1.2 and 1.3. Not all the principles have examples, but we will support and select appropriate diagnostic procedure and other types of health service-related codes. We develop and comply comprehensive internal coding policies and procedures that are consistent with requirements. So let's think about that. When we develop coding policies internal in our organization or procedures, they need to be consistent with those requirements. Well, those requirements reflect back to official guidelines, conventions, coding clinic, etc. So they need to be following that. We can't have coding policies and procedures that go against the official requirements and guidelines. And we foster an environment that supports honest and ethical coding practices, resulting in accurate and reliable data, which we all want is that accurate and reliable data. So one way you might do that is regularly discussing the standards of ethical coding at a staff meeting. Has anyone had any situation where there was incorrect coding or an unethical practice that they observed potentially? And let's discuss that. And what a coding professional should not do is we should not distort or participate in improper preparation, alteration, suppression of coded information. We should not misrepresent the patient's medical condition and or treatment provided, not supported by the health record documentation. Being ethical includes those steps as well. Under Principle 2, we must adhere to the conventions, as I mentioned, those official reporting guidelines, both the ones approved by the cooperating parties and the CPT rules presented by the AMA. We must select and sequence both diagnosis and procedures, the present on admission, discharge status in accordance with the definitions, and that's in all healthcare settings, not just a hospital inpatient setting or a hospital outpatient. That includes physician practices as well. We should also, as coding professionals, apply our skills, knowledge, and currently mandated coding classification system resources to select the code. Sometimes we have to research a particular situation, confirm the appropriate code for a clinical condition when not indexed in the classification. We should be doing that. On principle number 4, think about the AHA practice brief regarding querying. And here we say that the coding professional should participate in the development of query policies that support documentation improvement and meet regulatory, legal, and ethical standards. So, yes, you can put together query policies that help us get better documentation, improve it. But we must meet regulatory, legal, and ethical standards to do that. And an example is following the Achieving a Compliant Query practice. We should use the queries as a communication tool to improve the accuracy of code assignments and the quality of documentation. And they give a couple examples there. So when you think about querying, it's important to think about those. In addition, we should query with established practice guidance that don't conflict. When we have conflicting, incomplete, illegible, imprecise, ambiguous information, whether it be concurrent, whether it be pre-bill, whether it be retrospective. So concurrent is usually while the patient is in the encounter, any kind of encounter, outpatient or inpatient encounter of any kind, long-term care encounter. So while they're under the care. Pre-bill is you code, but you haven't billed it. So you sometimes query prior to dropping the bill. And then retrospective means after the bill has come back, you can query. So yes, you can query concurrently, but you should not query the provider when there is no clinical information in the health record that necessitates a query. You should not utilize health record documentation from or in other encounters to generate a provider query. We've had a discussion about that one, 4.5. So remember that you shall not utilize documentation from or in other encounters to generate a provider query. That's an important one to think about, and I've seen in blogs and out on the internet people asking that question. It's right there in the standard. Standard number 5, we shall select and sequence codes such as the organization receives the optimal reimbursement you're entitled to, remembering that it is unethical and illegal to increase reimbursement by means that contradict the requirements. Requirements are the official guidelines, conventions, etc. And we should bring to the attention of the organizational management any identified inappropriate coding practices that do not comply with requirements. So that's taking action upon yourself as a coding professional, being ethical, to bring to the attention that something's not right, and communicate with management about those. You can use a hotline, you can talk to your different departments that address the inappropriate coding practices. And you should bring coding errors to the attention of your administration and or coding leadership as soon as possible as well. What you should not do is you should not misrepresent the patient's clinical picture through intentional incorrect coding or the admission of diagnosis or procedures or the addition of a diagnosis or procedure unsupported by health record documentation to inappropriately increase reimbursement, justify medical necessity, improve publicly reported data. So in here in 5.3, by changing a record of a patient and or the business office requests that or tries to do that, it would be inappropriate just so they can get the covering of their insurance. Or omitting or altering a code to misrepresent a quality outcome. And I know I hear about those pressures from quality outcomes and meeting those scores of the quality. And so let's just not put that they have CHF. Let's make sure pneumonia is listed. You can't do those things. And it's part of your ethical responsibility not to do that. Also, you should not report codes for quality outcomes that incorrectly improve that. So that we've addressed in these standards a couple areas that may be near and dear to you that you've actually come up with as a challenge. In principle number 6, what should the coding professional do? assist with and educate providers, clinicians, and others by advocating proper documentation practices and further specificity for both diagnosis and procedures when needed, more precisely reflect the accuracy, severity, and the occurrence of the event. That's a good one, 6.1, what we shall do. So we should be helping providers, clinicians, to understand this. And we can do this by regular education sessions, especially on new requirements or when a requirement changes. When we get a CPT update, when we get new CPT codes like we're going to have shortly here in January, when ICD-10 changes and we have either a guideline change or codes change like we do every October, we should and we shall assist in educating everyone and others. We should review and share requirements on the standards of ethical coding. So these standards, you should share them. They're not just a closed book just for you to read, nobody else to see, private. No, we want these standards to be shared across the spectrum of healthcare with providers, clinicians, and others. So think about that. I believe we've included the standards as an attachment today, and so that might be something, and if we didn't, we can certainly make sure that it's part of the process for you to get that, and you can look it up on the internet. Number 7 talks about you personally as a coding professional, that you must maintain and continually enhance your coding competencies in order to stay abreast of changes in codes, documentation, and coding requirements. So that means participating in educational programs like today and reading the required publications, read the standards of ethical coding, and maintaining your professional certifications. Yes, you should do that to be ethical, and so the standard tells you that. Number 8 of the standard talks about the confidentiality, and many of you are very familiar with this. We've actually, since HIPAA, had this as part of our professional responsibility to protect all confidential information, only accessing information in the patient records necessary to do our job, and maintain, if you work remote, you must maintain protection of confidential health information. So we have a lot more professionals working from home in what we call home office, or at least in the home. We have to make sure that we have protection of confidential information. So in that environment, we want to make sure that we're not having the public or family viewing of any of that information that you're working on, health information. So you need to have protection of that. And if you work from home, have that remote coding, you want to think about, does my company, department, organization have a policy and procedure around remote coding and the protection of confidential health information, because that would be something you would consider putting in place to support that. Standard number 9 is that the coding professional shall utilize all tools, both electronic and hard copy, that ensure accurate code assignment. And we do sometimes have to do that. We have to look for information resources, information tools. We should recognize that computer-assisted coding and or electronic encoders are only tools and are not a substitute for the coding professional's judgment. Okay, let's talk about that one again. That the computer-assisted coding technology and electronic encoders are tools. And you as a coding professional, you have that judgment. You have that brain on your shoulders to determine what is appropriate and not. So remember that that's your responsibility ethically. And that you shall utilize electronic code and code title selection technology in a manner that is compliant with the coding requirements. Standard number 10 tells us that the coding professional must act in an honest manner and bring honor to self, peers, and the profession, respect truthful and accurately their credentials, professional education and experience, and demonstrate ethical principles and professional values in their actions to patients, employers, and other members of the healthcare team, consumers, and stakeholders. So that's a big one as well. And number 11 out of this group, which is the last one, but really covers an even broader. If any of the principles were not hitting home with you, this one probably does. It says that we shall act in a professional, ethical manner at all times. We take adequate measures to discourage, prevent, expose, and correct unethical conduct of colleagues. We shall be knowledgeable about established policies and procedures for handling concerns about colleagues, and usually an organization has a way to take unethical practices to your professional organization. You can seek resolution if there is a belief that a colleague has acted unethical. So look carefully at the bullets in here for coding professionals shall ethically and see if it resonates with you or that you've seen or heard that before. And 11.5 at the bottom, you consult with a colleague when feasible to assist in taking remedial action. We say, you know, I think this may be not coded correctly. I think there's an error here. Certainly we can do that, and we should do that. We shall not participate in, condone, or be associated with dishonest, fraud, and abuse, or deception. And this little list of bullets that you see here is non-exhaustive. So we actually, when we were creating these standards, had way more. But we shortened it down and combined some things because it really is important that you think about what the coding professional shall not do, because it does affect us in our workplace. You shall not participate in or allow inappropriate patterns of retrospective documentation to avoid suspension and or to increase reimbursement. You should not coding on an inappropriate level of service. You should not allow coding in at an inappropriate level of service. You shall not miscode to avoid conflicts with others. You shall not add, delete, or alter the medical record documentation. Coding professionals should not be altering medical record documentation. The coding professional shall not code from documentation that is copied and pasted from another clinician's documentation without that identification of the original author and date. That's an important one to note. And you should not engage in supporting negligent coding practices. You should not participate in or allow inappropriate retrospective provider querying, and you should not report a code for the sake of convenience or for a desired effect on the result. Carefully think of these bullets. These really do speak strongly to ethics and compliance. How do the AHIMA standards apply to your work environment? Start by asking yourself and your organization, your department, a few questions. Am I compliant with the 11 standards? Is my department or organization compliant with the standards? And once you've answered these, determine your next steps. One of the things you may need to do is make folks aware of the standards, maybe through a little in-service. So awareness and education may be needed. Or to correct an ethical situation, maybe it's awareness and education. Employee orientation and new hire. When you have a new hire, are you sharing the standards and requesting that they agree to follow the standards? Do you ask your coding auditors to utilize the standards, whether they be internal or external auditors? That would be something you could do. Request your organization acknowledge and embrace the standards. So how do you vet out when we think about those questions to ask? Now, granted, sometimes there are unethical things that happen, but unethical isn't necessarily illegal either all the time. But unethical can lead to illegal. So we have to make sure that we're remaining ethical. We need to utilize the official coding resources. Not only our official coding and reporting guidelines, but AHA Coding Clinic and AMA CPP Assistance. True story, a year and a half ago, or it was right around 2 years ago when we were implementing ICD-10, and I was talking about Coding Clinic and ICD-10 to a group of coding professionals that worked in the physician office setting, and 3 of them had said they had not read Coding Clinic, and all 3 of those individuals had been coding for more than 5 years. So Coding Clinic doesn't mean it's just for hospitals. coding clinic is applicable to other settings as well, including outpatient and physician office. So keep that in mind. That's an official resource, and to be ethical, we should be using those. Seek advice when you're unsure. Ask a question. Obtain that educational conferences, and again, about the staff meetings and new hires, and even maybe once a year, I'll talk about ethical coding. Do you have or have you had coding roundtables where you have an open dialogue with all staff, not just management? That open dialogue may be a place to talk about standards of ethical coding. Have you conducted an in-service on the standards outside your HIM coding circle? And even take the standards and share them with others, such as in the revenue cycle, or maybe make sure CDI, your internal and external audit teams, legal, and the compliance department needs to know and follow these as well. Now, being compliant also means following the official coding and reporting guidelines, as we said. And this truly is the guide for the professional coding professional for being compliant and ethical. When changes occur, it's imperative that your coding staff read through the guidelines, address any concerns or questions so everyone clearly understands them, CDI staff also. And there are times when physicians should really read these guidelines too, because they may need explaining to them on why a particular condition or disease or situation is not coded a certain way. You have guidelines for those. And as the first paragraph says, this is part of HIPAA. Did you know that, yes, HIPAA is privacy security, but it's also part of our official coding and reporting requirements. So following these is following HIPAA. So yes, there's a law behind this, and sometimes that's important to tell to others. And another wonderful resource that I can't not recommend and discuss is, of course, AHA Coding Clinic on ICD-10, CM, and PCS, and obtaining that as a resource must-have for coding professionals, no matter what setting you work in. And remember that these are approved by a cooperative effort between the American Hospital Association, the American Health Information Management Association, the Centers for Disease Control, CDC, National Centers for Health Statistics, and just CMS. Those four cooperating parties are critical for us to get good information. The AHA Coding Clinic Central Office serves as the national clearinghouse. For those that work in the outpatient and clinic setting, again, keep in mind that the AHA Coding Clinic is ICD-10-CM diagnosis coding, so it does apply, and it's your responsibility ethically to follow these guidances as well. And did you know that the AHA Coding Clinic does have physician input? Yes, they have an editorial advisory board with the four cooperating parties I just mentioned, and there are usually 3 representatives from the coding HIM industry. There are also physician members, and I've had this question asked of me many times by physicians themselves, and saying that this coding clinic is created by bureaucrats. There are physicians from the American Academy of Pediatrics, American College of Surgeons, the AMA, and the American College of Physicians. So yes, physicians do participate in, and inside the actual coding clinic publication, they do list the names of those individuals. So now that we've heard a lot about ethics, what does your compliance program do and look like? Well, it should do is detect and prevent fraud, waste, and abuse. It should have a definition of your expectation, and a culture should be generated from that. Do you have a coding compliance program in place? Does it contain these elements? Are these elements operational and effective, no matter what size your organization or department is? Think about these aspects and elements of compliance and your ethical responsibility. In the small box, you can see the 7 elements of the compliance program, which has been published by the OAG in the past. So think about the False Claims Act that I mentioned at the beginning and your liability there. Let's not forget that as coding professionals. If we knowingly take that aspect We knowingly present, we knowingly make. It's very important in that aspect that once we know the information, we act appropriately. We know the guidelines. We know how something's to be. So we know the rules around it. Now let's take a look at our final steps before we get to our question and answer. Know these compliance risks. Monitor news and blogs, the OIG report, discuss them and relevance to your department and your organization. Even adjust your own internal and external auditing areas of focus if you're doing focused audits by using and utilizing the OIG focused areas. Take these standards of ethical coding and share them. Discuss them at a staff meeting. Maybe even have staff acknowledge that they will follow the standards. That's an optional best practice. And be sure to share them with others because others need to know as well. Encourage open dialogue and ask questions. Remember, if something isn't right, take the first step to discuss it and bring it to someone's attention because often we say, that's not right, and maybe it isn't right. Watch when new technology gets put in place and make sure it's operating and the operational results are correct and ethical. Look at trends in data. We didn't get a chance to discuss that a lot, but that's a step to take. Querying providers, following those practice briefs, reading coding clinics, and rebilling when you have an overpayment. Making sure leadership and management demonstrate a commitment to ethical coding as well. They support and sustain a culture that is open to questions. It's okay to ask questions and make suggestions. And bring up documentation and coding issues and concerns. You should have a process and a culture to have this in place. And it should be very transparent in this ethical and compliance environment. So in summary, today you've looked at coding compliance risk areas. They may be fee-for-service, they may be a particular payer, they may be something the OIG has put together. Reading and following the standards of ethical coding is a must as a coding professional. Making sure you understand the standards and you share them with your staff and discuss them. There are 11 principles. Note the language that says share and shall and shall not in the principles. Share with management. Follow your coding clinic. Be proactive. Don't be complacent. Be compliant. Bring your ethical and compliance concerns to your management and your compliance leaders. Okay, that takes us to the end of our presentation. So I'm going to turn the program over to David, our coordinator, and he's going to open up some questions from you in the audience. David?
Thank you, Ms. Bryant. We have a couple of minutes left for questions. Our first question submitted is, do you think that technology is helping coding to be more ethical?
I do think that technology has had an added value to the coding process. It is a tool, and when it's programmed in a way that actually looks at things both ways, undercoding and overcoding opportunities, I think, yes, it is and can be helping us and enhancing us to be ethical, but it's our responsibility to use the tool correctly.
Thank you. Since we are at the top of the hour, I'll make this our last question. Would physician office practices also need to subscribe or read the AHA Coding Clinic?
Yes, definitely read the AHA Coding Clinic for physician office practices and the outpatient settings as well. There's a lot of diagnosis guidance for diagnosis coding. Granted, sometimes it talks about an inpatient setting that's very complex. But remember that your physician is seeing that patient in the hospital, and you will have an encounter to bill for that with a diagnosis as well. So it's important, yes, to follow that and have it available.
Thank you. I'd like to turn it back to you for closing comments and to wrap up.
Great, thank you. Well, we've included some resources for you today that I've used, and you should have your handout material. And there will be also a survey. So thank you very much for your interest in ethical coding and compliance. Please fill out the evaluation and tell us about future topics you might have. It's a pleasure being with you all today. And thank you all very, very much for your time.
Ladies and gentlemen, that concludes today's presentation. You may disconnect your phone lines, log off your webinars, and thank you for joining us this afternoon.